Yes. Yes.
Come on in, please. Kind of take a seat for me. Thank you. Right, my name's Dr. Gill. Before we go any further, could I please confirm your name and date of birth?
Yeah, my name's Abby Tucked and it's 7th of December 96.
Thank you. So we're here today to do your annual diabetes review. So to start off, just tell me how you're doing at the moment.
It's been a bit better than the last review. So I've been up and moving a bit more. I think I've lost a bit of weight. So I think we're doing okay.
Okay, so have you seen your blood results yet?
No, not yet.
Okay, well, we've got those here. We'll go through the other bits that we need to do and then we'll have a look at these shortly, but I think you'll be very pleased with the results we've got. Okay, so you've said that you've been sort of being a little bit more active and trying to lose the weight. How has your diabetes been generally of late?
I think it's been okay. I don't feel dizzy at all. I've been watching a lot more what I eat because Christmas you just want to sit down and eat whatever's next to you. So no, I've been watching a lot more of that. I haven't got the foot tingles, so that's been, I think, working.
Excellent. Yeah. So clearly we've been able to build on some of the things we discussed last time. Now, I've asked before, but we do need to check these things are current. Do you smoke at all?
I know.
Good, okay. Now, obviously, a diabetic review doesn't look at you purely as, a diabetic person. We want to look at you as a person that happens to have diabetes. So how are you generally? Are there any things that are bothering you at the moment?
No, it's just general back to work and back to normality stress, but we're good.
Okay. Now, obviously we've had COVID and things like that. Have you been able to get both of your vaccines?
Yes, I've had both now.
Super, and it's that time of the year again in terms of flu vaccines. Have you either had or booked for your vaccine yet?
I haven't seen any advertisement yet, but when it comes, I'll book it.
Super, okay, well, we certainly are taking those at the moment, so have a chat with the ladies at the desk once we're finished, and we can sort that for you today. Now, you mentioned that you've been doing really well losing weight. Is that something that you've done yourself, or have you been, talking with one of the dietitians, something like that?
I did have a talk with them, but it's been mainly me watching what I eat, calorie counting, things like that.
Okay, super. So the dietitian, was that something that you organised, or did that come from us previously?
That came from here.
Okay, so you've had, and they've gone through all the structured sort of diabetes stepwise approaches to diet and losing weight. Excellent. Now, the next thing we need to look at is just how you're monitoring at home. Do you check your blood sugars at all?
Yes.
Okay, and how are they at the moment?
They're generally okay. I've had a few spikes, but that was just when I was being a bit ditzy and not recording it, but that's fine.
Okay. But as long as we've got a good control over those now, that's the main thing. And do you do your blood pressure at home?
Yes, the machine's just broke though, so I need to get a new one.
Dear. Well, we'll be doing your blood pressure in a moment. What numbers have you been seeing at home?
I think it's been slightly on the high side. I've been trying to get it down, but I can't get it lower than maybe 140 over 100.
Okay, so that's still quite high for yourself. Now, I know previously you weren't very pro letting us put on one of the medications for the blood pressure. I think it's important that we reiterate that those medications also protect your kidneys. Now, we are going to check your blood pressure here in a moment, but I think even if we start at a really low dose, it will be a good idea to start this medication called ramipril.
Okay.
Has your mind changed on that at the moment?
Yeah, I've been trying to do it my own, but it looks like I do need a bit of help.
Okay, excellent. Now, we'll start this at a really low dose, 1.25 milligrams. Now, this is a medication that from a diabetic perspective will also protect your kidneys. Okay. But it can make people's kidneys work harder when they first start them. So what we'll need to do is repeat your bloods in 2 weeks' time after you've had the medication for a week, and we'll make sure your kidneys are all right with that.
Okay.
Does that sound reasonable? Okay. So let's check the blood pressure and things anyway, but I think we need to have that medication because it's a useful one with regard to diabetes regardless.
Okay.
Okay. And have you brought the sample of urine requested?
Yeah, but
Super, so if we put that on the table. Let me just put these gloves on, and what I'll do is I'll go and start this processing over by the sink, and we'll also take you over and we'll see how we're doing with your weight, doing your height and weight. Okay, so if you come with me, please. And then step onto the scale. Super. Okay, that's grand. And if we just move over to get your height. So if you can come, step backwards on for me. Okay, and down, and step away, please. Okay, so 166 centimetres. Right, let's go back. So we've definitely got some sugar in there, but there's no protein, there's no blood, and there's nothing else for us to worry about. So that's reassuring, but we definitely need to sort out that sugar for you. Okay, so that's your height and weight and sorted. Let's just get you to lie on the bed for me, and we'll check your blood pressure. Okay, and if you just relax back for me. Okay. So what we're going to do, we're going to use the manual blood pressure cuff. Okay. We'll run this twice, once without the stethoscope and once with. Okay. Before we start, do you have any problems with your arm at all?
No.
Good. Okay. So just make sure that we've got the right sizing there for you. And do you have any problems with your shoulder at the moment?
No.
Super. Okay, so let's put that on here. Super. And just relax there. So you said yours was 140, so I'll have to go a bit higher than that. Okay. So that looked like it was about 142. Okay, we'll do the same again, but now with the stethoscope. Okay. So it's actually a little bit more, 144 over 8. Okay. It's a bit large, but we'll certainly deal with that shortly. Now, let's have a look at your feet, and we'll see if we can see any issues there. Okay, so just relax for me, and we're going to just check what your capillary refill is. 1, 2, 1, 2. Okay, so that responds nicely. Now, just need to put your trousers up slightly, please. Okay, and we're going to check the pulses. Okay, so that's the posterior tibial. That's behind your ankle. That's all good. And we'll check over the front, the dorsalis pedis. That's good. We're going to have a look at your heel. So I can't see any signs of ulcerations. There's no calluses at all. That's good. And we'll check again on the opposite side. Again, no obvious issues. We'll check between the toes, make sure there's no signs of bleeding or anything like that. Okay, so we've got a neurotip here. Okay, so this is just a simple filament. So please close your eyes and say yes when you feel me touch it with it. Okay, so you close your eyes.
Yes. 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 Yes.
Just going to check on the base of your feet.
Yes. Yes. Yes.
Super. We've got excellent sensation there to your feet. So I appreciate that the pins and needles that you've commented on, but everything looks to be good there. So let's go back over the side and carry on our conversation. Okay. Right. So if you want to take a seat again. So everything there was looking very good. I appreciate that the comment you've made about pins and needles to the feet, but all of your sensation there seemed absolutely excellent. So what we'll do the referral to the diabetic structured help group, and we'll see what other optimizations we can find with regard to your diet. We've got the metformin. Now you're taking so far 1 gram, so half a gram twice a day.
Yeah.
We're going to increase that up a little bit. We'll do half a gram, but we're going to do that 4 times in a day.
Okay.
Please make sure you take it with food, and that way you should get the best benefit from it and hopefully the least side effects. Now, did you have any side effects when you started metformin the first time around?
Can't seem to remember.
Okay. Sometimes as we go to the higher doses, people can get a bit of an upset stomach. But if that happens, as probably happened last time, it should resolve after 2 weeks.
Yep.
Okay. We'll start the sitagliptin. Okay, so you shouldn't really have any side effects of note with that. But if you get any severe tummy pain, I need to know about this.
Okay.
Okay. If we just touch base in 2 weeks' time and see how you're doing with those medications, and I'll put a blood form at the desk for you to repeat these bloods in 3 months' time.
Okay.
Hopefully, with the diet, the increased exercise and the help from the structure group, we'll be able to get that diabetic number under the magical 48. I think we can get there.
Okay.
Okay. Have you got any other questions for us today?
No.
Super. Well, thank you very much. If there's any problems, then do give us a call. And the one thing I just need to double check with yourself before we go any further. So because the metformin and the sitagliptin you'll be having, just refresh my memory. What are the sick day rules with regard to the medications?
So if I am feeling ill, including if I'm being sick or I have diarrhea, I need to stop my medication. So I know my metformin's one I need to stop, and I need to refresh my mind about the glycoside, but I know that I need to stop these on the days that I feel ill, and then when I start to feel better, then I can restart them. Make sure that I'm drinking enough, that I'm not becoming dehydrated, and that I'm checking my blood sugars a lot more.
Terrific. So in terms of those medications, because they're not all ones that we would necessarily give you, an easy way to remember them is the SAD-MAN drugs. So we'd want to stop something called an SLGT2 inhibitor. You don't have those.
Okay.
We'd need to stop the angiotensin converting enzymes, so ACE inhibitors. So that will be the new medication that we've just given you, the ramipril. We'd also need to stop any diuretics. Thankfully, that's not an issue for yourself. You've said metformin, quite rightly so. A different medication, an ARB, again, not one for you to worry about. And our N for NSAIDs, so if you're feeling unwell for yourself, make sure you're avoiding ibuprofen, anything like that, because that can make your kidneys work harder. The other thing that I think will be worthwhile going forwards is just keeping a quick check on your blood pressure, particularly whilst we're starting the ACE inhibitor.
Okay.
Okay, so we're going to hopefully get your blood pressure on average under 135 over 85. But as you said, you've tried a few things at home, cutting down salts and trying to get a healthier diet. That can help, but hopefully we'll get a benefit from the ACE inhibitor as well. Okay. So any other questions to myself about that?
No, I don't think so.
Right, we'll leave it at that. Thank you very much for your time, and we'll have a chat in 3 months.
Thank you.
Take care. Say yes if you feel it.
Yes. 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 Yes.